I'm from Punjab, which is a northern province in India. I always wanted to become someone who was able to help people. I wanted to be a nurse because I had this cousin of mine who was a nurse, and I always looked up to her. And then later on, after completing her nursing degree, she moved to the US and she became a registered nurse. So right now she's a nurse practitioner in the US, and I'm so proud of her. I wanted to be the same. I wanted to exactly do whatever she was doing, which was amazing. But then life happened and I had to stay back, do my master's degree, and I had no intent to go anywhere but to stay at home, to stay in India. And then when I was pregnant, we started thinking about what was going to be our next step and how our families would help. And that's where we decided that we would move to Canada because the entire family lived in Canada. But then the big question was, what am I going to do when I get there? Am I going to be the nurse as soon as I get there? It was really a scary question. The research made me realize that the process was long, but when you have to start something and you're really motivated, you want to do it, you just jump into it. Before I moved, I decided to again do my research on Canada too, and everything I heard, everything I got to know was nothing but positive. That Canada is a country where my dreams could come true, where I would be more flourished and I would be much more established in my profession. And then security. My life as a woman is much more secure in Canada as compared to my country back home. I feel safe for myself, I feel safe for my children, which is another reason why I personally moved to Canada. For me, the process of becoming a registered nurse was kind of unknown. All I had was information from a couple of websites, but there was not a single human who could tell me exactly that these are the steps. I had to do everything on my own, and trust me, it was a struggle. Sometimes I was frustrated, sometimes I felt like quitting. When I was talking with other people who were going through the process at the same time, they were equally frustrated. They said they were equally complaining that lack of information, lack of knowledge, and no help from the regulatory bodies was something which was always forcing people to quit. And a lot of people quit too. Like I can name a lot of people who quit the journey in between. So that's what inspired and motivated me, that I have to be a little different. I have to be at the forefront and start helping people. When Stenberg invited me to work with the Post Graduate Diploma in Canadian Nursing, I was super excited because this program was exactly what anyone would need to become a registered nurse or a licensed practical nurse in Canada. As an immigrant nurse myself, I understand and I hear all the problems and all the apprehensions an international student comes to Canada with. So this program is not only something which is just based on textbooks and we're just in a classroom. It's way beyond than that, because this program is going to help you pursue two of your dreams. Number one, to become a registered nurse in Canada, and definitely number two, to settle down permanently, which is becoming a permanent resident in Canada. And I'm sure a lot of you come with that dream. I have had tons of students who are proudly working as registered nurses in various hospitals and long-term care facilities in Canada, and I feel so emotionally attached to them. So there is this one student who calls me as her big sister. She was always contacting me, asking me for what to do and stuff. And once she saw me in emergency where I worked, she was like, oh, I want to be like this. I want to wear the same clothes you're wearing and all that. It's so exciting to say that now she is one of the crew members at emergency and a registered nurse. So it feels so great, and I'm humbled to have all those students in my life, that I'm able to help them. One of the great things about the postgraduate diploma in Canadian nursing is that it gives its students the opportunity to have a paid work experience in the healthcare setting, in the real Canadian healthcare setting. Here, you are working full-time, you are being paid exactly the same amount which anyone else working in the same position would be, and you're going to be working as a registered healthcare professional, getting first-hand experience of Canadian healthcare settings, looking with your own eyes how the registered nurses work, how LPNs work, who are the licensed practical nurses, and how the healthcare team works with perfect collaboration and cooperation. So this is amazing, and these benefits, they are going to help you in future as well, because you're not only making money, but this experience is going to be counted whenever you go for asking jobs as registered nurses or licensed practical nurses. Being a registered nurse is really a challenging job. It's not the job which you will do just for money. You have to be really passionate about working in the field. The Canadian healthcare team, the culture, it makes me really comfortable at work. I'm not scared that what my bosses are gonna say and what am I gonna do if this person comes and asks me a question, because everybody is so comfortable. And then if I'm passionate, I will be happy. There's a huge difference being a nurse in Canada versus being a nurse in India in various respects, though being a nurse would mean the same everywhere in the world, because we're still saving lives, we're still treating the same human bodies. In Canada, when I started working, I felt huge pride that, okay, I was responsible for my patient. When the relatives were coming, they were asking for the nurse, which was giving me happiness, because I need to know everything about my patient. And it's not only about having that 12 hours shift with the patient, but knowing them as a person from every point of view. Whereas in India, we're really focused on just the medications and the treatment part. We are not so much into holistic nursing at this point, I believe. Then the second thing is a lot of cleanliness. Even the general ward was like the cleanest place I could imagine. In India, if you have to have those kind of facilities, you need to throw big bucks out of your pocket. And then if we are talking from a nurse's perspective, dignity and respect is one of the first things which come. Canadians really respect nurses. If I have to give a piece of advice to a nurse from India who wants to come to Canada, the only thing is that do not delay it. If you are a registered nurse in India, you have at least a year of working experience. You have gathered all the information you needed to. You're confident enough that now you can just start this journey because you're ready. The more you stay, you're actually delaying yourself from those opportunities. So you may think that I will move when this happens, when I get married or when this XY, but things will keep flowing. But these opportunities which you may be getting today, you may not have them tomorrow. So just take that step and come to Canada whenever you feel is the right time.